This is Notebook LM. This is a Google-based product, so I am signed in here with my Google account through my institution. So you would need to have a Google account to use this or create one. So once you're on your sort of main page here, you can just click Create. All right, now what this does is it will take sources that you add to it and then use those sources to make you different study aids. So this is a tool that a colleague turned me on to, and then a student actually mentioned to me that they use. And so what you do to start is you add your sources. All right, so I'm going to use a PowerPoint slide deck that I use to teach cirrhosis pharmacotherapeutics. So I'm going to add that. And then I'm going to go ahead and add some more sources as well. So let's add some guidelines. That should be good. All right. So the PDF is just PowerPoint slides. So if you click on any of those sources that you've added, the AI will generate like a little summary, but you'll also see the content below. Now it looks a little wonky because it reformatted my PDF of my PowerPoint slides, but this is just a usual PowerPoint presentation that takes you through pathophysiology, some patient assessment, a little bit of pharmacology, but mainly, pharmacotherapeutic decision making. And then at the end, there's some pharmacokinetic and dynamic considerations in the setting of end-stage liver disease. And then these are the guidelines that are associated with that content that, largely were used to make the PowerPoint. So it just gives it a little bit more granular detail to pull from. So in here, you've got, a summary here, but you also have the ability to ask the AI some questions. So it generates questions for you that you could ask. You just click on that, and it would prompt the AI to answer that question from the sources that you've added over here. So, the question was, what is the underlying pathophysiology of cirrhosis and its common complications? So you can see the output below, pretty good summary there. So you can pick from questions. You could, ask the AI. And it'll generate a response there for you. So this is, like a nice tool that students might like to use when they're studying as a way to, kind of quiz themselves. They could use these questions. They could make their own questions. They could try to think of the answers before the answers populate, or, sort of not look at the answers, quiz themselves, and then look at the answers. What I think is pretty cool is this podcast option. So over here you can generate a podcast from the sources that you've added. So before I do that, I'm going to give it a little instruction. So let's just use All right, so I'm going to give it a little extra instruction to generate the podcast. Now, I don't know for sure which elements that I've just put in really seem to help drive the podcast towards pharmacotherapeutic content. However, I will tell you, when I did not give this instruction, the podcast that was generated was much kind of higher level, spent more time talking about like non-alcoholic fatty liver disease and the obesity epidemic, and things that were a little less pharmacotherapy related. And so it was like a 25-minute podcast that didn't really talk very much about pharmacotherapy. But when I've given it prompts like these, the output has been much more robust. So we're going to go ahead and hit generate. Now that does take a few minutes to generate, so just as a heads up. So while we're doing that, I'll just show you a couple of other things. There are some other tools that you can use over here, or that you can mention to students to use. You can generate a study guide from your sources over here. All right, we'll open that up. All right, so this, basically just gives you like another way of looking at the material. So, outline format now rather than PowerPoint slides, and then gives you some quiz questions that, maybe you post for students, or maybe, this is something students are using on their own. And then with those quiz questions come an answer key that they can review. There's also, essay questions in here. There's key terms that it will pull from the content. So maybe this is something students, have alongside them as they're, studying, so that when they see an abbreviation in your notes, they can just quickly see what that is, rather than, trying to find where in your PowerPoint slide deck you initially explained or defined the abbreviation. All right, so we're still generating our podcast. The briefing document's another option. All right, so here it just gives you, again, kind of an outline, like a studying outline, but just in a different format. So if students are looking for additional things to review, students are always asking, like, what other content can you post, to help us with the material. And I always think, use my slides, the guidelines, maybe the Puro Pharmacotherapeutics textbook, if that's the textbook your school uses. But since students ask for additional content frequently, perhaps this is something you could use to post some additional content, or again, something you could turn students onto, that they could generate this content themselves. All right, just waiting another minute for our podcast to generate. All right, so we've got our podcast generated, so let's go ahead and listen to it.
All right, everybody, welcome back.
Yeah.
We're going to be doing a deep dive today on cirrhosis.
Yeah.
We have got the AASLD practice guidance from 2024 right in front of us.
Yep.
And I'm really excited to get into this one. I think this is a really relevant topic, especially for pharmacy students. Yeah, and one of the things that struck me right away was how cirrhosis, it's more than just liver disease, right?
Oh, yeah.
It impacts everything in your body.
Yeah.
And it's especially how you metabolize drugs and how effective certain therapies are going to be.
Absolutely.
And so I think that's one of the big takeaways here is we really have to understand how cirrhosis impacts the body
Exactly.
before we can even start talking about treatment options.
So you've got decreased amino acid metabolism.
Yeah.
Increased ammonia levels. Decreased muscle mass. Yeah.
Protein synthesis is reduced.
Yeah, it's crazy.
Less clotting factors made.
Yeah, and then carb metabolism is all out of whack.
Right, so you get hypoglycemia, cholesterol production is reduced, detoxification, impaired drug metabolism. I mean,
Yeah.
the list just goes on and on.
Yeah, it's wild to think about how impactful this is on just medication choices in general. So let's talk about portal hypertension.
Okay.
So portal hypertension, I know it's increased pressure in the portal vein.
Yeah, it's technically defined as a hepatic venous pressure gradient, or HVPG, that's greater than 5 mmHg.
Right, but in the real world, it's hard to measure an HVPG, right?
Exactly. So we also use the serum ascites albumin gradient, or a SAG, of greater than or equal to 1.1 GDL
Right.
for diagnosis.
Okay, so then I see here that there's this new concept in the guidelines of CSPH,
Right.
clinically significant portal hypertension.
Yep.
And so this is defined as an HVPG of greater than or equal to 10 millimille Hg.
Yep, and that's really the level where you start to see increased risk of decompensation. Okay, so like what are some of the bad things that can happen with portal hypertension?
Well, the big ones are ascites
Yeah.
and variceal bleeding.
Oh, right, because all that pressure
Exactly.
in the liver is making the blood go like somewhere else.
Right, it starts shunting blood away from the liver into these splanchnic collaterals.
Yeah.
And that's what leads to those gastric and esophageal varices.
Okay.
And as that pressure keeps increasing, those varices get bigger and bigger,
Yeah.
and the risk of rupture and bleeding goes way up.
And I remember from our lecture notes that it said like 25 to 40% of cirrhotic patients will experience variceal bleeding at some point.
Yeah, scary stuff.
Like that's a huge number.
Definitely.
So how do we manage this?
Well, for portal hypertension specifically, we often use non-selective beta blockers like propranolol, nadolol, or carvedilol.
Oh yeah.
You know.
Old school beta blockers.
Yeah, they work by reducing portal pressure by constricting the splanchnic arterioles, which reduces the blood flow into the portal system.
Okay, so the goal is to prevent.
Yeah. The goal is to prevent.
Like the enlargement and the bleeding.
Yeah, to prevent them from getting worse and bleeding.
Right, not to like.
You can't prevent them from forming.
Yeah, prevent them from forming.
Once they're there, they're there.
Yeah.
And that's why the guidelines only recommend NSBBs in patients who have endoscopy-proven varices.
So you can tell the podcast wasn't perfect. You know, there were some mispronunciations. They said ascites instead of ascites. You know, splanchnic was said maybe a little wonky. But overall, you know, in 3 minutes, they've already gotten to, you know, the basics of some of the pathophysiology happening in cirrhosis and have already moved into the complications of cirrhosis, which is really, you know, portal hypertension, ascites, you know, variceal bleeding, hepatic encephalopathy, spontaneous bacterial peritonitis. You know, so in 3.5 minutes, they've already probably made it, you know, maybe an eighth of the way through my slide deck, which this particular lecture is usually, you know, a 2-hour lecture. So kind of cool. And the sound is neat. You know, there's some minor hiccups here and there, and you can expect that with the podcast. But generally speaking, this sounds like, you know, a 2-person podcast or a 2-host podcast, much like you would listen to, you know, on Apple Podcasts or Spotify or wherever you get your podcasts. So kind of a neat alternative way to have, you know, your students interact with the content. So, you know, to use this, I would recommend that you review the entire podcast and maybe, you know, post that a pronunciation may be wrong, or you know, if there is like a particular section that is incorrect, I might download the podcast and then throw it into, you know, like a video recording software and edit, you know, parts of it. If, you know, there's some hallucinations in there, which can happen, to make sure that, you know, I'm posting the most accurate version for students.